Underneath hospitals all over the country lies a silent killer. We all know that asbestos causes the cancer mesothelioma. What many of us may not know is that some Australian hospitals still have the deadly dust coating service tunnels that snake through the bowels of the buildings. In some places it's been removed or sealed, but not everywhere, and it's already proven fatal. Matt Peacock has this 7:30 investigation on a lingering menace.
Deep underground in one of Australia's major hospitals, a deadly menace is lurking. It is asbestos, and breathing its dust can kill.
It is in the boiler houses, in the laundry, fire doors. Hospitals are full of asbestos. We shouldn't have to worry about catching a deadly cancer when you go in a hospital for treatment.
Most major hospitals have service tunnels like these, deep underground, full of steam and hot water pipes, often wrapped in asbestos insulation or lagging. Sometimes the columns have been sprayed with asbestos fireproofing. The tunnels are frequently used by staff, nurses, doctors, even patients, to move from one building to another.
It just makes us angry that we're still dealing with this sort of thing in 2014.
They don't want people to think a hospital, which is a place of, health and good environment, is filled with something that's deadly, is pretty frightening, I suppose.
With less than a week to go to the official opening by the Premier, Mr Rann, workmen today were putting the finishing touches on the $175 million hospital complex.
Ever since its construction in 1978, Sydney's Westmead Hospital near Parramatta has had an asbestos problem, both inside and outside. It was built upon tens of thousands of tonnes of dumped asbestos.
And it's evidence enough to me to look amongst the grass here to see the very many chips of asbestos cement laying everywhere.
In 1979, a former James Hardie engineer, Fred Sandilands, then dying from the asbestos cancer mesothelioma, showed the ABC's nationwide program where the company had disposed of its asbestos waste all around the area.
Fred Sandilands says thousands of tonnes of asbestos were dumped along this road near the Westmead Hospital.
Now, more than 30 years later, the unions complain asbestos regularly rises to the surface outside the hospital.
The gardeners, even up until recently, were mowing these areas, and one gardener, told me about the fact they used to mow over it and it was, a big poof of white smoke.
Some erosion has occurred across some parts of Westmead Hospital, resulting in some of the fragments of material included in the landfill coming to the surface. Now, as that occurs and as those fragments are identified, we are responsible for cleaning that up.
Of all of the country's hospitals, Westmead is probably unique because it's built on top of an old James Hardie asbestos dump. And when you walk around the car park, you can find lumps of asbestos. Like this one, with the fibres still clearly visible. And there's another problem, and that's underneath the building. "7:30 has obtained this recent secret footage of the service tunnels that run underneath Westmead Hospital. Early this year, the alarm was raised after an apprentice inadvertently cut through some asbestos lagging here.
Young, untrained apprentice was cutting something he shouldn't have been cutting, but he wasn't warned or anything that there may be asbestos in the area. Some disciplinary action was taken against him and sort of everything came untangled from there.
Westmead's tunnels have been closed since to all but a select few who wear personal protective clothing and face masks. Hundreds of people have used or worked in these tunnels over the years. Loose bits of asbestos can still be seen in the walls and on the ground. This old sign shows the asbestos hazard was identified decades ago, but not removed. According to Westmead's chief executive, the tunnel asbestos is sealed and safe.
There is asbestos in the tunnels, but prior to the disturbance of the lagging on the piping within the tunnel, all of the asbestos in those tunnels was contained.
How was it contained? Because your own occupational hygienists who've gone through there have said and identified friable asbestos throughout the tunnels on many sites, and it appears to be...
I'm not aware of any report that speaks to friable asbestos in the tunnels.
But 730 has obtained a report by consultants Prensa written only 2 months ago, stating that there was friable, that is dusty asbestos, throughout the tunnels. High-risk blue, brown and white asbestos dust was on the columns, concrete surfaces and paths, some of it with a high potential for disturbance. And there's now a clear warning in the tunnel for friable asbestos.
That is outrageous to see loose asbestos that contains amosite and crucidolite on the ground with people walking through in 2014 really makes me angry.
Alarmingly, over the years, members of the public have also been invited into the tunnels.
It's not a simple case of just the maintenance staff that have been down through the tunnels. They've actually taken TAFE students down there to look at the pipe work. They used to have open days for families, Halloween parties, used to put up all decorations and try and make it scary, but not everyone knew at the time what the actual scary thing was down there, and that's the asbestos. I shudder to think that I could have taken my kids on a tour through that place.
The asbestos in the tunnels has been tested for the purpose of whether it's airborne or not, so a series of tests have been undertaken. All of the tests that have come back have not identified asbestos at detectable levels.
But that's a reassurance the union doesn't accept.
There's no doubt in my mind that numerous people have been exposed to dangerous levels of airborne asbestos.
In other major hospitals around the country, in Melbourne, Brisbane, Adelaide, Perth and Sydney, it's already been established asbestos in their tunnels has killed.
A number of cases from a number of different hospitals where people's exposure was walking through the tunnels 10 or 15 times a day. Nurses, speech pathologists, doctor, and that's their exposure to asbestos.
We went up and down the tunnel 10 times a day. And there were always people working on it, and the pipes, there'd be plumbers and doing things. I mean, no one thought there was asbestos or there was any danger. I mean, you do expect that your workplace is a fairly safe environment. So I suppose it's a bit of a shock when you find out that a hospital is full of asbestos.
Annabelle Crouch worked as a speech therapist at Sydney's Royal North Shore Hospital for more than 3 decades. But because of her asbestos exposure there, she's now living on borrowed time. Recently, her doctor told her she has the fatal and incurable asbestos cancer, mesothelioma.
I remember thinking, well, that's unbelievable. And then everyone I'm telling, is saying, what? And people obviously all rushing to Google to find out how long I had to live, because it's a pretty horrible disease. And when I first got it, the doctors told me not to start looking up Google too much, because they said, look, there's not a lot of good news on it, and it'll be very depressing for you, and it's not always as bad as that. And so I heard enough anyway without getting onto Google. But I know it's 18 months to 2 years survival rate after diagnosis is the general rule. So it's been 2 years just to the end of last month.
Like other hospitals, Westmead also has other asbestos hazards inside the building. Many of its fire doors throughout the wards contain asbestos cores. Although the hospital says it's progressively removing them, there's evidence of doors that have been damaged or cut, potentially releasing the dangerous dust.
If it came to my attention that the way in which we were dealing with any of these incidents or events or hazards was inadequate, I would respond.
Asbestos is a problem in hospitals nationwide, one unlikely to go away anytime soon without more money to remove it once and for all.
No one wants to think about it because it's going to cost money to remove it. So we don't talk about it and we wait for the asbestos fairies to come in the night and take it away. And it's not going to happen. We need to start removing it systematically.
It's going to be a frightening problem in the future, and they're going to have to stand accountable at some time for what's happened.
Matt Peacock reporting.